Welcome to my channel. In pregnancy, experiencing vomiting, acid reflux, and heartburn is a common problem. Among these, the most common problems are related to acidity and heartburn. From the first month of pregnancy until delivery, all pregnant mothers may suffer from acidity related issues. Especially during the last 3 months of pregnancy, these problems tend to increase. Sometimes it heartburns, other times it anorexia, and sometimes it's indigestion after meal. This issue often accompany pregnancy and can worsen as time goes on. To find relief from such problem, many pregnant women resort to various acidity relief medication, which can potentially harm the unborn baby. So, in today's video, I will discuss about why do acidity and heartburn occur during pregnancy. Number 2, what should we do if you experience acidity related issue during pregnancy? So, let's get started. Before that, we need to understand some basic concepts. In the image, you can see the gastrointestinal tract with a long section attached to the everyone's mouth called esophagus. The esophagus is the food pipe through which food travels from the mouth to the stomach. In the connection between the mouth and the stomach, there are two sphincter muscles that act like valves. When food is moved downward, it is open, allowing food and liquid to pass through, and it closes again. Inside the stomach, various enzymes including hydrochloric acid are present, which play a crucial role in digestion. It's because of this sphincter muscle that food and acid in the stomach cannot easily move upward. The components of digestive system contact in a rhythmic, wave-like motion at specific intervals. This helps in moving food gradually downward. This was the normal process of food intake. Now, if for any reason the acid in the stomach manages to push the esophageal sphincter upward, your chest starts burning and throat feels irritated. There is belching, a sour or acidic taste in the mouth, and feeling fullness in the stomach. Now, let's discuss our main topics: why acidity related issue and heartburn occur during pregnancy. Generally, there are 3 common reasons why pregnant mothers experience acidity related problem. Number 1, hormonal changes. After conception, a pregnant mother's body undergoes various hormonal changes. These hormone shifts can slow down the movement of digestive system in the pregnant woman, causing food to take more time to digest. This delay of digestion can lead to feeling fullness and increased acidity production, contributing to discomfort and acidity related problem. Number 2, relaxation of esophageal sphincter muscle. Progesterone, a hormone that is present at higher level during pregnancy, can relax the esophageal sphincter muscle. This muscle is responsible for closing of valve between the esophagus and the stomach. When it relaxes excessively due to hormonal change, it may fail to close properly. As a result, stomach acid can flow back into the esophagus, leading to heartburn and other acidity related issue. Number 3, uterine enlargement. During pregnancy, the size of uterus increases significantly as the part of natural process of gestation. When the uterus becomes large, it can create additional pressure on the stomach. This pressure can also contribute to the relaxation of the esophageal sphincter and slow down the movement of food in the digestive system. This can result in heartburn and acidity reflux, especially during the last 3 months of pregnancy, when the uterus is at its largest. Now, let's discuss the how to prevent heartburn and acidity related problem during pregnancy at home. Number 1, include dairy in your diet. Consuming dairy product like milk or yogurt can help to reduce heartburn. These products contain calcium, which can help to neutralize stomach acid and reduce the symptom of acid reflux. Number 2, honey and warm milk. Mixing 1 to 2 tablespoons of honey into the glass of warm milk can provide relief from heartburn. Honey is smoothing and milk can help to neutralize stomach acid. Number 3, avoid overeating. Our stomach is somewhat like a muscular bag, and when we consume a large amount of food at once, it tends to get filled up like a balloon. This excess pressure can cause stomach acid to rise, resulting in acid reflux and discomfort. To avoid this problem, it is essential not to overeat. Divide your daily meals into 4 to 5 smaller portions and eat them at regular intervals. This can help to reduce the chance of experiencing acidity-related issues and heartburn significantly. Number 4. Eat early at night. People who eat late at night and go to bed shortly afterward any experience discomfort including heartburn and burning sensation in the chest. When you lie down after eating, stomach acid can more easily flow back up through the esophageal sphincter. To prevent this, it's crucial to finish your evening meal at least 3 hours before going to bed. If you plan to go to sleep at 11 pm, try to finish your dinner by 7 to 8 pm. This not only helps control your body weight but can also reduce likelihood of acidity related problems inshallah. Number 5. Avoid acidic fruits. Certain fruits with higher acidity level can contribute to acid reflux and heartburn. It is advisable to avoid consuming citrus fruits and their juice on the empty stomach. The acidity in these fruits may irritate esophageal lining and lead to discomfort. Number 6. Avoid oily, spicy and fried foods. Foods that are oily, spicy or deep fried can exacerbate acid reflux and heartburn. It is essential to avoid such food during pregnancy as they can trigger to origin acidity related issues. Number 7. Limit caffeine containing foods and drink. Certain foods and beverages such as tea, soft drinks, chocolate and coffee contain significant amount of caffeine. Caffeine can weaken the esophageal sphincter muscle, making it more susceptible to allow stomach acid to flow back up into the esophagus. Therefore, it is advisable to limit or avoid this caffeinated item to reduce the risk of acid-related problems. Number 8. Chew fruit slowly. Chewing your fruit slowly can aid in digestion and help to reduce the chance of experiencing discomfort related to acidity and heartburn. When you chew food well, it is broken down into smaller particles, making it easy to your stomach to pass. Additionally, avoid drinking water immediately after eating. Wait for 30 to 60 minutes before consuming liquid to aid digestion. Number 9. Be cautious with medication. Certain medications such as aspirin, tricycline, antidepressant and pain reliever can contribute to stomach discomfort and heartburn. Additionally, medication containing progesterone like Progest, Microgest, Gestinol and similar drugs may also lead to acidity-related issue during pregnancy. If you need to take such medication, you must take acidity-reducing medicine along with them. 10. Choose loose-fitting clothing. Wearing tight-fitting clothing, especially around the abdominal area, can put pressure on the stomach and exacerbate acid-related issue. It's advisable to put for loose-fitting and comfortable clothing during pregnancy. Loose-fitting garments can help to reduce pressure on the abdomen and provide relief from discomfort. After following this instruction, if your problem is still not resolved, you must definitely advise from your medical practitioner. Without a doctor guidelines, do not take any acid reducing medication, otherwise it could be lead to harm for the baby. Your healthcare provider can assess your specific situation and provide most appropriate recommendation. I hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness and reproductive health related all the videos. And remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.